Hi, Andrew Bowser with Internal Medicine News. Thank you for taking my question. This is actually for Dr. Mahajan, and the question is, well, and for the panel, specifically for the data. I would assume that fragmentation of care has been looked at in other chronic illnesses of childhood going into adulthood. So how do these data compare to that experience in other chronic diseases?
So that's a great question, actually. So I would say a very somewhat similar disease in terms of the models of care can be hemophilia as well, where there's been a lot of attention, as with sickle cell disease, paid to the pediatric to adult transition time period. I don't know in hemophilia if anyone has actually particularly looked at fragmentation of care in the way we have done here, so it's hard to compare it exactly. But I know that it has definitely been an area of study, and they have done implemented certain changes within that field and within the hemophilia treatment specialty care centers to sort of improve the transition from the pediatric to adult care model to provide more comprehensive care.
Okay, and just a quick follow-up if I could. So I kind of get that it's kind of bad to have fragmented care.
Yeah.
But specifically, why is that? Is it a quality of life issue, or is it a quality of care issue? And kind of what can be done to reverse the fragmentation that's seen in SCD? I mean, that's
so I think,
on the scope of your study, but...
No, I think that's a great question. I think we have to ask ourselves what we can do as a health system, as providers, because obviously there are social issues that we may not necessarily be able to change quickly. So I think having the lack of insurance was striking to me, that increased the risk of fragmentation, and it made sense to me, obviously, too. But I think that is something that we do need to tackle as a society at some point, probably. And also just being able to provide a proper transition for young adults as well, I think is very important. And I think probably that may happen at certain centers, and it's probably likely based on location as well of where patients live as to how likely that is to happen. But it would be great if we could make that something that would happen across the board. And also having more experts in sickle cell disease practicing medicine, I think would also be very helpful in enhancing the field.
Annette Brindle from BioWorld. I have a question for Dr. Onalo. What is the mechanism of action? It would not have occurred to me that arginine could be an analgesic.
Thank you so much. That's a beautiful question. The exact mechanism of action is not known, but there are speculations on the likely mechanisms. Arginine is a molecule that participates in various biochemical pathways in the body. And it is thought that it's either the analgesic property is being operated through one of them, or a summation of the various metabolic pathway. The most plausible explanation that have existed is that probably there is its involvement in the production of nitric oxide, which is a blood vessel relaxer, may be contributory. However, there have also been a study that shows that the analgesic properties of arginine is beyond the nitric oxide production. It has been shown that arginine also have an anti-inflammatory ability, and probably this acting along with the nitric oxide ability, production pathway could account for the analgesic property that is seen.
Hi, John Geaver with MedPage Today. Actually, a follow-up question on that to Dr. Penapinto. Is arginine recommended in the United States? Is it commonly used? I would think the way the world works nowadays, there have been a number of publications in the scientific literature about it, and surely this has gotten out into patient support groups and so on. So, what's the situation here in the United States?
So my understanding in the United States, there were some trials done with oral arginine used for prevention, which were negative studies. This is my first knowledge of use in acute setting. Yes, I'm looking at the expert in the audience. But there is going to be some future work looking at use of arginine in the US for patients presenting with pain. So I think it's too early to say all patients should start this medication, including what would be the right dose. So I think this is the first step, at least in Africa, where we...
This is not something that parents come to you to say, can I use this in my kid?
No, I mean, we've been looking at and thinking about arginine for a long time, and so I think this is a really exciting study to finally now see some positive findings that should lead us to future work to really understand better how to use the medication.
And also, if I may, a question for Dr. Mahajan, a technical one. In your table 1, the one titled Risk Factors for Fragmentation of Care, it's the incident rate ratios. How is fragmentation of care defined for purposes of that table?
So we did a Poisson regression model because we wanted to look at, I have to go back.
I mean, it must be something like more than 1 or more than 2. Or
exactly. So we were trying to compare across, like on a continuum, essentially, because we wanted to compare 1 versus 2 versus 3 to 4 versus 5. So we couldn't just do a hazard ratio based on that.
Right. But so what's the reference number?
I believe it's just 1.
Okay.
Yeah.
Thank you.
Any more questions up front?
If nobody else has any questions. So I have a question on the NFIX study, and this looks like it may be one of the very few of these repressors that look promising as a potential target of therapy. Are you thinking this would be more for gene therapy or some sort of, how would this, there's a lot, you said there's a lot to go between your investigational stage now and actually making this a medicine, but how do you kind of envision that playing out?
Sorry. In terms of our company, we're devoted to making a small molecule, so something that's orally bioavailable. We're not a gene therapy company, and so for us, we see, the discovery of NFIX and then understanding how that interacts with other known repressors is really kind of the avenue that we would pursue. With that said, because this is a novel repressor that we discovered, there could be regulatory elements for this repressor that are specific to red blood cells, much like the gene editing approaches for BCL11A, which is currently some of the more exciting data around gene therapy and gene editing. And so, I think as other investigators kind of build on this finding, there could be an avenue in terms of gene therapy, but that's unknown right now.
Additional questions?
Lynn Peterson with Trends in Medicine. So while we think gene therapy, we've been hearing a lot about it at the meeting the last couple of years, there's nothing here. Is there no advance that rose to the level of an ASH press conference in gene therapy? So, I mean, what's going on? Is there a delay? Is it not working out? Just sort of give us...
Yeah, I don't have knowledge of that. Just what you'll see here at the meeting is all I'm aware of. So I know that on Friday there was a special symposium regarding cures. So there were lots of information presented there, in addition to some presentations and posters. So I'd encourage people to go see those.
But there's not is it taking longer than expected? Is it harder to do than expected? I mean, I'm just...
Yeah, all very good questions, and I think we are not the scientists behind the gene therapy at this point, so not sure we can answer your questions directly. Good, other questions?